Good morning. I would like to begin by acknowledging that we are gathered today on the traditional, unceded, unsurrendered territory of the Anishinaabe Algonquin people who have inhabited and cared for these lands since time immemorial. We express our deepest gratitude and respect to them. The fourth session of the INC is well underway now. It has been encouraging to see member states' seriousness to rapidly get to the substantive matters at hand. The challenge over the next days will be to shorten the lengthy document while ensuring that its most critical and ambitious elements are not watered down or eliminated as we move to the last round of negotiations at the end of the year. In this regard, it was a positive sign to hear host country Canada's Minister of Environment, Stephen Guilbeault, affirm at the very outset that the treaty must restrain plastic production in order for it to be effective. Hopefully, we can build consensus on this coming out of INC4. Of course, in parallel to production limits, the instrument's success will also intrinsically depend on how it governs chemicals and petrochemical extraction. Studies on chemicals and plastics have shown us time and time again that restrictions of chemicals of concern are fundamental to ensuring the safety of human health, particularly of Indigenous communities, waste pickers, children, and other vulnerable groups who are most heavily impacted by plastic pollution. We will hear today directly from elected councillor Janelle Nahmabin on the long-standing struggle and resistance of the Aamjiwnaang First Nation against the toxic impacts of the petrochemical production cluster in this very province. We are hopeful that the strong representation and advocacy at INC4 on the damaging and even lethal public health effects of thousands of chemicals used in plastics will provide the necessary momentum for member states to make progress on this element of the Plastics Treaty. At the same time, the interconnected fossil fuel, petrochemical, and plastics industries continue distracting progress, as they have done throughout these negotiations. They maintain a singular focus on narrow, end-of-life solutions, when in fact our center of attention must really be at the source of the problem. This treaty is not only about recycling and waste. As we heard from the Global Waste Pickers Alliance earlier this week, the Global Plastics Treaty is a matter of life. Communities and workers all across the globe want and deserve better options. Options that preserve our right to health, our right to a healthy environment, our right to decent work. Through a strong global plastics treaty, states can give industry the right signals on the primacy of public health over profit. Thank you.
Good morning. My name is Karen Wirsig. I am Senior Program Manager for Plastics at Environmental Defense. Plastic pollution is a global crisis that intensifies every day that we let plastic production and use go unchecked. Aamjiwnaang and other communities on the front line of plastic pollution cannot afford business as usual, and yet we are seeing business interests far too present on the negotiating floor, while First Nations have no official voice. It has taken until today for delegates to begin discussing in detail the control measures we need to see around the world to stop plastic pollution and protect our health and frontline communities from devastation. These measures include an immediate cap on plastic production and a timeline to reduce production over time, requirements for transparency on just what chemicals are being put into plastics, elimination of toxic additives, including bisphenols, phthalates, and PFAS, and elimination of harmful single-use products. We will be watching the countries that say they want ambition, including Canada. We expect them to champion strong measures and find a way to get beyond industry-friendly delay tactics from a small group of like-minded countries and make progress on these essential elements of a global plastics treaty. Thank you.
Good morning. My name is Dr. Sehjal Bhargava, and I'm a resident physician in public health and preventive medicine and family medicine here in Ottawa. I'm pleased to be here on behalf of the Canadian Association of Physicians for the Environment to amplify the call for urgent and ambitious global plastics treaty and to call on the Canadian government to take immediate action on plastic pollution for our planet and our health. Plastic production threatens human health at every stage of life, from cradle to grave. Plastics are a toxic exposure problem. The news of plastic being found on the most remote regions of Earth now has parallel news from health. Microplastics are being found in our blood, lungs, placental tissue, and even crossing the blood-brain barrier. Further, exposure to plastics and its toxic components are inequitable and disproportionately impact Indigenous and racialized communities, such as what is being currently seen in the Aamjiwnaang First Nation, women identifying persons, children, and workers. In my family medicine practice, my patients include pregnant people and children of all ages. These children are growing up with unprecedented exposure to plastic and its toxic byproducts, introducing risk factors and impacting health through the lifespan in ways that we don't currently understand. But the evidence we do have is grim. Exposure to the additives in plastic are already linked with central nervous system dysfunction, endocrine disruption, immune suppression, and systemic inflammation. Micro and nanoplastics have even been found as components in samples of the plaques found in blood vessels that are linked to devastating events like heart attacks and stroke. With something as pervasive as plastics, it is up to decision makers to do the right thing for health and protect people from the consequences of continued exposure to plastic-related pollution. Canada must make health and environmental justice a key focus in the Global Plastic Treaty and in federal policy. Action today could save billions of dollars in healthcare-associated costs and directly help prevent negative health impacts such as neurodevelopmental and reproductive disorders, obesity, asthma, and cancers in present and future generations. We need an ambitious global treaty, but there's also no need to wait. The Canadian government must act now. Recent commitments, such as the new registry to track plastic production, are commendable, but far more is necessary. This is the moment to show ambition and leadership. We call on the federal government to make concrete commitments to reduce plastic production, utilize nature-based solution and Indigenous knowledge with consent, eliminate toxic additives, address environmental injustice in our communities, and protect the health of people in Canada. Thank you.
Buju ani kinawea, Misconwood Quen Indigenous Cosmakwa and Doda Aamjiwnaang and Donjaba Anishinaabe Kwe and Dow. My name is Janelle Nahmabin. I'm from Aamjiwnaang First Nation. We're on the outskirts of Sarnia, Ontario, also known as Chemical Valley. This is where 40% of Canada's petrochemicals come from. My small First Nation community is surrounded by over 60 petrochemical facilities. As a result, Aamjiwnaang's inherent rights, human rights, and nature rights have been the sacrifice zone for industry for over 100 years. Last week, my community went into lockdown due to dangerously high benzene levels, still in lockdown. Children sick, our childcare and school closed, our administration closed, people stayed indoors and fear even the air that they're breathing inside is poisonous. Why? Because we're a stone throw away from Ineo-Styrolutions, which uses benzene to produce styrene for polystyrene operations, one of the most commonly used plastics. Our concern isn't only that one facility. We have aged equipment that has collapsed. That's Imperial Oil's aged equipment, a Suncor tank exploding, which caused a community evacuation, and numerous hospital visits from children. Microplastics are also found in our river from Nova Chemicals. What I'm sharing with you is nothing new. In fact, the UN Special Rapporteur on Human Rights, our Human Health and Toxics, visited my community when he did a tour of Canada. His report was issued in 2022, and it says the following. The situation of Aamjiwnaang First Nation in Sarnia is profoundly unsettling. Deeply connected with their land, the residents on the reserve have been invaded by industry as far back as the 1940s, but it's been longer than that. They are now almost entirely surrounded by over 60 industrial facilities whose presence creates physiological and mental stress among community members because of the risk of impending explosions or other disasters, and because of chronic exposure to unquestionably poisonous substances. Sarnia, one of the most polluted places in Canada, has been dubbed Chemical Valley. Various interlocutors acknowledge that existing regulations do not protect the health of Aamjiwnaang. Improvements can be made in terms of investigating the health impacts, conducting proper monitoring, and enforcing existing standards. Risk assessments do not fully take into account the cumulative health impacts. The environmental injustice to which Aamjiwnaang is subject to is an ongoing tragedy. The legacy of a land use planning that would never be allowed today. It continues, but I'll leave it at that. With UNDRIP being adopted, it needs to be included in the plastic treaty because the people impacted by plastic pollution from extraction through pipelines to refineries to microplastics are the ones that most impacted, mostly Indigenous people around the world. It's worth mentioning that the environment I live in is a result of inadequate regulations, monitoring, and enforcement. Plastic pollution has been able to increase in my nation due to lack of regulations that would protect our rights and our health from plastic pollution. We need stricter regulations that eliminate chemicals and polymers of concern with deadlines for outcomes that are enforced. And not in 100 years like the people of Aamjiwnaang have had to go through and that we continue to go through. Industry self-reporting is not working. We need regulations that guarantee Aamjiwnaang and Indigenous peoples around the world a safe and healthy environment. We do not need any new plastic facilities. What we need is a binding cap on plastic production moving forward. Chimigwech.
Morning, everyone. My name is Melissa Gorrie, and I'm a law reform manager with Ecojustice Canada. Last week, as many of us were preparing to travel to unceded and stolen Anishinaabe-Algonquin territory, also known as Ottawa, for these plastic treaty negotiations, Aamjiwnaang First Nation Chief and Council issued an alert to the community warning of high levels of benzene in the air, as Janelle has just mentioned. We know that this styrolution styrene plant has repeatedly released benzene into the air at levels that exceed what is acceptable. And the Ontario government has failed over many years to adequately hold the company accountable and to enforce regulations. What is happening in Janelle's community demonstrates why the plastic treaty needs to center human health, Indigenous rights, the right to a healthy environment, as well as address the environmental racism and environmental injustice that is at the heart of the plastic pollution crisis. What is happening in Aamjiwnaang is an environmental emergency, and the long history of environmental racism and colonialism that the community has experienced requires immediate action from the federal government, especially as it hosts these pivotal international negotiations to end plastic pollution. That's why this morning, just now, a few minutes ago, a letter signed in solidarity with Aamjiwnaang First Nation by more than 100 organizations from around the world was sent to Minister of Environment and Climate Change, Stephen Guilbeault, and other members of the federal government and other levels of government. As a global collective of many Indigenous peoples, frontline communities, environmental activists, health groups, and civil society members, we are calling on the federal government to take immediate steps to ensure the styrolution plant in Sarnia is closed until such time that Aamjiwnaang First Nation is satisfied, not the government satisfied, the First Nation is satisfied that styrolution is able and willing to meet the health-based air quality standards and the community demands. Minister Guilbeault has an obligation under the United Nations Declaration on the Rights of Indigenous Peoples, as Janelle had mentioned, as well as the Canadian Environmental Protection Act, to address this urgent situation and these environmental injustices. As host to this plastic treaty negotiations, we expect the federal government to take immediate steps to demonstrate leadership on the global stage. We need action, not just words. They must take these actions to protect frontline communities in line with their commitments to advance an ambitious global treaty that tackles the full life cycle of pollution, including production at the source. Failure to act puts at risk Canadians' reputation and credibility, both domestically and internationally, as a leader to address the plastic pollution crisis. Canada must act with integrity and walk the talk, set an example at the global stage by taking action to address this environmental emergency and the environmental racism that Aamjiwnaang First Nation has experienced from benzene pollution for far, far too long. Thank you. I think we're now open to questions.
Hi, thanks for taking some questions. Natasha Belowski with Canada's National Observer. Janelle, I would love to hear a bit more about the benzene lockdown that has happened. You know, I don't know if this has happened before. Any details you can provide about what that's been like and what has happened similarly in the past?
Okay, so we have been exposed for numerous years. Only in the most recent years are we able to have air monitors in place to validate what we have already been saying, that we're exposed to these high levels. Every single family on Aamjiwnaang has gotten sick from this most recent release. My family, my children, my husband included, my neighbors. It's an ongoing thing, so that's why I'm here, hoping that people hear what I'm saying, can feel what we're going through, and stand in solidarity with us.
As a follow-up, how much opportunity and in what format have you been given any opportunity to, speak to delegates from other countries, Canada? What type of FaceTime have you been able to get to talk about this issue?
Sure. So my collaboration has mostly been with Ecojustice, environmental defense, as well as the Society of Native Nations, hearing from the people on the ground that are experiencing these. So this has been my approach to really understanding the full cycle of plastics. Thanks.
Thank you. This concludes the press conference.
Could I add one thing to that? If there's no more questions? Are you okay with Sure. Yeah, you just mentioned about the FaceTime with other delegates. So in the negotiation space, Indigenous peoples are not there on a nation-to-nation basis. They don't have seats at the table. So Janelle and others have to use the process set out by the United Nations to try to seek 2 minutes to speak on the floor in the plenary, and that's definitely not guaranteed. They have no right to be there on a nation-to-nation basis to speak and have their concerns voiced.
Thank you. This concludes our press conference.